Namaskar, hello and welcome to this very special edition of the Medical Hour. This Medical Hour is brought to you from the Diary of an AIIMSonian and the AIIMSonian in Dr. Surbhi Vash Mittal. She would be really taking us through to this very exciting roller coaster journey of medical education. And this Medical Hour is focused upon presenting you the intertwined insights into the integral facets of medical education. And as the maiden edition, we learnt about the tips and tricks of cracking the NEET examination. So the entrance examination is just the end of a grand beginning, and the five initial years of the preliminary stage, which is called the MBBS programs, I think it can be really exciting or exciting and enthralling, and it can equally become truly frustrating because in our country entrance examinations are given so much of importance than the real program per se. And somewhere because of this anomaly, the structural anomaly, and a topper is one who takes the burden from topping the entrance examination to really taking the whole toil across those 60 odd months and thereafter the internship year as well, including all that. So this is a subset series which we are calling it as a making the most of the MBBS program. And giving a context, there is a lot of, I would say, a challenge in the entire Indian medical education and the entire medical profession per se. For example, we all study, the whole focus is on studying for the NEET examination, the NEET UG, we call it. And then the other clamor, which keeps on, I would say, affecting the whole public discourse is the NEET PG examination. पर इन दोनों एंट्रेंस एग्जामिनेशंस के बीच में क्या हो रहा है, संभवतः उसके बारे में कहीं कोई चर्चा परिचर्चा है ही नहीं। डॉक्टर सुरभि ने जैसे कहा कि अगर आप कोई एंट्रेंस एग्जाम में जा रहे हो तो आप उस जीवन के लिए कमिटेड होना चाह रहे हो, you want to live through that life, you want to live and lead that life into that professional discipline for that matter. So हम लोग we will be going back and forth into the pre-medical part of it all, the medical, the 5 grueling years as to what a core nucleus of the medical education is all about, because the whole myopic aspect of the super specialization, or the other contemporary word which is coming out, is the sub specialization, the procedure driven thought process with lot of equipments, with lot of procedures and surgeries and hospitalizations involved. But philosophically, medicine, the key kernel, I being a non-medico and IIT and myself, you would see in these conversations some kind of non-medico terms from the engineering domain. The key kernel, the core nucleus of medical education is perhaps the MBBS program. And today in this session, Dr. Surbi would be unraveling the anatomy of medical education. Anatomy remains one of the classic subjects, initial professional subjects in MBBS program. Dr. Surbi will be talking us, comprises of three profs as they are called. So the whole anatomy, she will try to give a complete snapshot of what we will be actually doing in any of the medical college per se. And since she would be bringing to us the nuts and bolts from the most premier institution, the All India Institute of Medical Sciences, New Delhi, perhaps this learning, it would really distill down to across the medical colleges, the 818 odd medical colleges and counting across the country. So over to Dr. Surbhi for her free-flowing, I would say, commentary. And as and where as a student, as a non-medical student, I would be butting in, I would be posing questions just for the sake of clarity. And these will be freewheeling kind of sessions where she will be really bringing it out, her passionate, I would say, striving, apart from preparing for the entrance examination, which she aced undoubtedly. But then she also aced her medical education, the trials and the tribulations. This is just the preliminary session, and after that, we will be picking up one or the other subjects, and that would have a different anatomy, that what that subject presents, and being a practicing clinician herself, how that subject's real hands-on education really helped her helps her in treating, diagnosing, and healing the patients. That is the end goal of any profession for that matter, that how efficacious you are. And more importantly, कुछ किस्से, anecdotes, और उन anecdotes से कि कैसे professors, the doyen medical professors of that subject, they instilled that learning, uh, the learning, the lifelong learning germs in her, and the key wisdoms and all that stuff we will be unraveling in sessions to come. So without any further ado, over to Dr. Subi for taking this session forward. Yeah.
So, greetings to one and all, and we are talking about unraveling the anatomy of medical education. I would start by saying the AIIMS motto, which says "Sharira Madhyam Khalu Dharma Sadhanam," and this is, in a sense, the spirit of the AIIMS doctors, that to create a healthy body and a healthy mind. So, in order that the person, the jiva, is able to perform all his functions and duties in this mortal life. Now, coming to MBBS program, making the most of MBBS program, friends, AIIMS, the All India Institute of Medical Sciences, is indeed a temple of medical learning. And I would say here that our MBBS curriculum is divided into three professionals: the first professional, second professional, and the third professional. And I would take you through an interactive journey, narrating my incidences and anecdotes from various facets of this 5.5 year long journey, wherein the first 1 year is, of course, the first professional, where we have anatomy, physiology, biochemistry, and the second professional is 1.5 years, and where we have microbiology, pathology, forensic medicine, pharmacology. And of course, the final professional is of 2 years. So 4.5 years of these three professionals and 1 year of internship. So, the medical education is something which really connects you to the life per se of a human being. From all cycles, from pediatrics, neonatology, when we are talking, the child is born, and rather from the embryology aspect, you take from and then the child is in the form of the fetus in the mother's womb, when then pediatrics to adolescent age group, then adulthood, then obs gynae for the women, and women health, and then internal medicine, surgery, community medicine, and then various disciplines we are dealing with. And then the final profession, you go on to community medicine, and then you have in internship your rural postings, where in AIIMS we used to go to the comprehensive rural health services project at Ballabgarh, Haryana. And there's a really a very tremendous kind of a project there, where hands-on learning of what you have learned during your MBBS program, you're actually practicing it. And I would like to assert here, start my talk by saying that, you know, the acharyas of medical learning, the professors who are teaching you at your medical colleges, I would narrate here from my experience, that really it was a divine and a very fortunate, I should say, treasure trove of learning from the doyen professors at AIIMS. And I'm bringing my AIIMS medical education here at every point in time, because it is important that for a successful medical career, your MBBS foundations are sound and profound. And friends, let me tell you one thing, that the MBBS program in itself, which we say the Bachelor of Medicine and Bachelor of Surgery, is in itself so deep that our country's medical needs, which are there in the form of, which what we say primary care practitioner, or a primary care physician, the MBBS program empowers you for all this. Very, very profound and very deeply. So if you have your fundamentals right, if you have your concepts right in the MBBS, you can really be a great doctor. And of course, if you want to go for your future fellowship program or a post graduation, that is dependent upon your, it should be determined after you've seen some lot of cases, and that will be a further journey in specialization, which we call as subspecialties rather, because these are a lot of surgical oriented and procedure centric and deeper knowledge into these disciplines. But the MBBS program per se is a very, very powerful, empowering program, and I would urge our medical aspirants and medical students, who are the would be wannabe doctors, that study these 5.5 years are really exciting. It's going to be a roller coaster ride, and we hear all kinds of stories and news, that the first prof, is a really shocker to the medical students when they enter the medical colleges. Why it is so? Why it is so? And then the final prof, the examination comes in the Guinness Book of Records. It is being listed as one of the very toughest examinations. So, what is the essence of this all? What are we arriving at? What are we achieving out of this? When the goal is clear, when the end goal is clear, you reverse engineer and you make your concepts your fundamentals, your foundations very strong. And that is very important. We'll also understand here that during the medical curriculum, it often happens that students from the first year itself, they have programmed their minds, oh, I want to be a cardiologist. At the end of 5.5 years, I'll be appearing for a NEET PG exam, for which I have to prepare from the first day itself in MBBS. So I start reading, in addition to my textbooks, the multiple choice question papers of the NEET PG of the last years. And once I do the NEET PG, I'm preparing for my DM, which I'm sure that if I'm doing a cardiology, I want to do another DM in a further subspecialty. So I'm preparing in the MD days for the DM program as well. So in this run for distinctions and degrees, we are actually losing that precious, valuable education, medical days. In fact, Eric Siegel has written a novel called The Doctors. In fact, Robin Cook also writes a lot of series on the medical fiction, and these novels have instilled the excitement and the entire, I should say, the enigma of the medical profession. It is when you're treating the human body, every human body is different, is unique. Though structurally, anatomically, the structure may be the same, but the metabolic response, the drug response to various treatments, every human body is a jiva, is a soul embodied, a divine soul embodied in a physical structure. So when you are dealing with human lives, it says the most complex machine on earth is the human body. So you are dealing with that machine, that divine creation. It entails necessarily a high degree of sensitivity, empathy, skill sets, yes, of course, knowledge, competence, but compassion largely. So these attributes are very, very crucial and critical in the uh, you know in the in the entire medical career. So I would like to say that when you are embarking on your medical journey, listen to doctors, listen to good experiences, watch fiction serials, medical operas like Doctor House is there. We have Grey's Anatomy, so on and so forth. So anyway, so this is in brief the spirit of the medical curriculum, and I would like to take you through the journey for the first prof, second prof, third prof, and in this session, of course, we are unraveling the basic spirit of it all. In internship, you are having your circulation in various departments, where there's a month long in internal medicine, one month long in surgery, in pediatrics, and obs-gynae. So 12 months internship is divided into various departments. Then you also go into certain elective, certain additional departments like radiology, anesthesiology, and even for that matter, you see some onco departments also. And because AIIMS being a tertiary care hospital, you get the exposure to the DM level of departments in terms of your internship, and there is no limit to learning. I mean, the our professors at AIIMS never barred us that if you have completed your stipulated hours of ward rounds, that if you cannot do more, you can always do more. And if you're staying in the campus, why not make the best utilization of this? In fact, I would like to really quote here that during my gynecological posting in the internship, I studied 32 deliveries in the labor room. I attended these deliveries. I learned so much, actively participated. So every Every posting, every subject, you're learning the theory, you are doing the labs, you're doing the ward rounds, then you're coming back to your textbooks, you're seeing patients, in the internship also, through live cases. So all that correlational, how the brain wiring which goes in the mind, in the brain, it leads to a lot of deep knowledge. And that knowledge has not to be limited to just question papers and examinations.
Dr. Surbi, with your permission, I would really like to just come in for a moment that while Dr. Surbi is talking and eulogizing the entire institution of All India Institute of Medical Sciences, and thanks to Madam Sushma Swaraj, who, while being the health minister during the Atal Bihari Vajpayee Sarkar, thought of expanding the AIIMS network. Now we have such a sprawling network of 23 odd AIIMS, almost one in every state of the country, and still the challenge of intertwining the AIIMS pedagogy down to the state level, the federal challenges are still existing. But I would really like to say that once we hear it all, you should, in whatever medical college you are, this adoption of the AIIMS pedagogy can always be done by the students and the faculty and the management combined. And the entire purpose behind is not to create a kind of caste system or a class system out here. But
Yes.
somewhere like if an institution has really since 1956 onwards and counting, if this institution has really set out some of the futuristic frontiers and globally best medicos across specialties, it's one of the most, I would say, even the IITs don't enjoy such a close knit community what these Amazonians have. Because the kind of relationship we have, so I think these learnings should be taken up with humility. In whatever medical college we are, Dr. Surbi's tips and tricks are largely to help you to make the most of an MBBS program. Yes, the practices are coming from the AIIMS, so let us try to adopt what makes an AIIMS, and that is what really will make us a Vikasit Bharat. When each of the medical institutions, their directors, deans, medical superintendents will really, with open hearts, with open mind, will really adopt and accept this AIIMS pedagogy. And somewhere or the other, the government is doing a lot. The Ministry of Health and Family Welfare is trying to its level best. The top-down efforts are happening, but ours is more of a lateral, a professional kind of an effort कि भाई हम भी कुछ गिरिराज जी में अपनी लठियां लगाएं, so that this entire model of excellence can be proliferated across. Over to Dr. Surbi.
So, I would like to say here one more thing, that medical curriculum in itself, it involves a lot of self-study. Self-study in the sense of, we say that a medical student always keeps on studying and learning till the last breath. So this is something that learning and studying is a part and parcel of your career. Even when you are a full-fledged doctor, there might be some cases which would, every day you would reflect upon, spend a few minutes or an hour at least, hour or two, in reflecting upon, touching upon the latest research papers, CMEs, and so on and so forth. And a lot of cases are involving multidisciplinarity, you know so, well, if you are a specialist, even in the specialty, there are several intonations, narratives which need, interdisciplinarity. So that is very important. So to understand that the human body is an integral whole. And I would urge that even those medical students who are having an aspiration of becoming a top-notch super specialist, well, we must have this concept, this principle clear from the very first day, that you might be a neurosurgeon, you might be a cardiac surgeon, you might be an endocrinologist, or you might be a GP. Your understanding of the human body as a whole, interlinking the various systems, should never go for a six. And it is, I'm just quoting here in generally what is the problem faced by the patients largely, because you see, we have to keep on going back and forth. Here the essential nuggets of medical education have to be listed right at the outset, so that we know in under what guidelines are we approaching our program? You see, द्रोणाचार्य तो शिक्षा दे रहे हैं, पर अर्जुन बनने के लिए हमें वो वी हैव टू हैव दोस ज्ञान चक्षुष, वी हैव टू हैव दैट एसर, वो मछली की आंख की तरह अपना गोल बिल्कुल क्लियर होना चाहिए. सो वेयर in NEET examination, where you are applying for the medical entrances, rank is important. But when you enter the medical college, it's important that you get your principles, your concepts, your understanding of the medical disease spectra very, very vividly and completely. Friends, I must tell you, it helps a great degree when your concepts are embedded in your brain, and it just unfolds like with like reflex action when you're seeing the patients. It helps. And when our professors are, banging on our head with saying that, in the physical examination, of course, I would like to say a lot about, the clinical methods in physical examination. Today, with the host of medical diagnostic technologies available, it is quite easy for the doctor or the treating physician to tell the patient, go and get a CT scan done or an MRI done, and the diagnosis would be clear from the CT or MRI very easily. But this is the dynamics which we need to understand. So here I'm bringing again back and forth the concept of the diagnosis through physical examination, history taking, is how important it is. And if you're there has to be a protocol of approaching the patient. You see, if you're writing a CT or MRI in the very first instance, one, you are going away from the clinical protocol. You are missing essential steps in the history and physical examination, which could have guided to a
I think,
different
Dr. Saab, that
diagnosis.
is something we will be picking up in more of a clinical part of it. But here, the anatomy of the medical education you touched upon very, very well. That the 5 grueling years out there, and the students who have just earned their rightful place to become a medico. You still have not to become a medico. It is just the end of a grand beginning. Your selection in a NEET or entry into any of the medical colleges for that matter, your family has a lot of expectations from you, the society has a lot of expectations from you, and you somewhere get the preliminary right to wear that white coat and go on to the ward rounds and things like that. And it is here where you have to chisel that whatever specialist, super specialist, sub specialist you have to become. But these 5 years and the three professional examinations and the 24, 34 odd subjects, what are out here on the backdrop, if you can see so, they really constitute the core of any medico. And it is this knowledge which really helps you to become any of the further sub specialist, and somewhere or the other what Dr. Surbi herself chose to remain an integral healer, integral specialist, straddling across all body as a whole. And that is something which is a pedagogy which she is evolving and practicing herself phenomenally. So, Dr. Subi, kindly take us through each of the topics quickly, because this is more of a kind of a overview. Let's not get into the clinical practice per se, that we will come in further sessions.
Sure, sure.
But
So,
let's touch upon each of the subjects and draw it from this is what you studied somehow in your NEET, in your entrance examination. This is what you would be studying in the medical college, and why you have to study it all. Quickly, a quick synopsis, and then we will be picking up each and every subject in later subsequent medical hours. Yeah.
absolutely. So, the clock has started ticking. You have started your first professional, and the first subject, lo and behold, you go to is anatomy. And anatomy takes you to the dissection hall, where you are, analyzing and learning human anatomy through cadavers. And anatomy is a very essential subject, important subject, in which you will study the from top to bottom. If I take it from head and neck, the brain, skull, hard, what we say in computers, the hardware. So the hardware of the human body you are studying. And from the upper limb, lower limb, the various systems, all the organizational structure you are studying. And anatomy, in a sense, I would say that quick learning points are that, you know, your DH sessions, the dissection hall sessions, are very critical. Again, I would say linking the theory and the practical part of it is the foundation, because when you do surgery in the final year, when you study surgery in the final year, your concepts of anatomy will come into action. Then again, in anatomy, we have tissue structure study, which we call as histology. It's a subject of anatomy that is important, comes into pathology, very applications in pathology, which you will be studying in the second prof. Now, coming from the 11th and 12th, in 11th and 12th classes, when you're in the K-12 level, you're also studying the anatomy of the human body in to a certain level, wherein the respiratory system, say, the two lungs and, the trachea and how the various, in that, the anatomy physiology is interlinked. So this first year is very important from the student's point of view to really enjoy and learn the human anatomy from the structural part of view and visualization. I would urge the students to, learn through the actual bones. How you are going to study the various veins and the nerves. Everything is
So
interlinked.
this is more of a foundational program,
Yes,
and we will be talking more about how to study anatomy in the medical art dedicated to that.
correct.
But just to give some popular interest, if you have seen Doctor How, Good Doctor, the eminent surgeon out here has all the human anatomy embedded into his brain structure, the 3D holograms which are projected. He finds a way out of it for surgery. So this foundational program has to be really immersed upon. And even being a GP, if you are really seeing it from a consulting perspective, a thorough knowledge of anatomy is really helpful, because a very, very finely trained physician, without using much of the gadgets and instruments, if his or her anatomical knowledge is strong, they can
Yes.
really land up at an accurate diagnosis. Is just ziffy, as we can call it. Yeah.
Absolutely. So,
Moving
coming
forward.
to the next subject, we have physiology. Physiology, of course, talks about the dynamic systems of the body, how they are functioning, the various organ systems. Physiology takes you from sleep disorders to, to understand circulatory system to nephrology. Everything has the basis in physiology. And friends, when you're studying physiology, it's important, again, I would say, the science of visualization. When you're studying the optic eye system, how the eye functions.
So,
In
Doctor, what is the difference between anatomy and physiology? Kindly explain that.
Definitely. Anatomy as a subject talks about the body structure. It just talks about the body structures in detail, wherein, like, we are studying the bones, the arteries, the veins, what are the nerve plexuses which are serving the body, but it does not tell the interplay, how the life, the motion, the dynamics, how the functioning is happening comes in physiology. So it's like if you have a computer, the hardware is anatomy, and the programs which are learning the functioning entire, from the cp-rom, the processor, how it is all functioning, is the life of the system is physiology.
Like, for example, heart and kidney, the interplay between the two systems, that is what physiology is all about.
Not just the interplay between the heart and kidney, but how the heart functions as a whole. And this is, in physiology, we study what is normal, you know
Mhm.
so how a normal body functions. Now, this is in a sense a very detailed knowledge and understanding, And if you understand, then when we study physiology, we realize how complex the human machine is. Every single cell, every single neuron, every single nephron of the body is a powerhouse in itself. This we realize when we study physiology. And that is where I would like to bring in here Professor Dr. R.L. Bijlani, sir. He used to bring in the various integral aspects of the healing through learning physiology. That is important, because this is the essence of the human functioning. That is, in nutshell, the physiology. Of course, when we'll be dealing with the medical art and physiology, I'll take you through in detail the various organ systems and how to approach them in a sense to understand the crux of it all. So this is there. Then we come to biochemistry. Biochemistry, the third subject of the first prof, is, as the name suggests, biochemistry. So it talks about the metabolic cell reactions in the various organ systems. And biochemistry is very, very interesting because, friends, we have all studied biology and chemistry in 11th and 12th. So you might be saying biology plus chemistry is biochemistry. Well, this is the biochemistry of the human body systems. So, for example, when you are the respiratory system, we all study that we inhale oxygen, we exhale carbon dioxide. But what happens when the oxygen goes inside the lungs? What happens when what all the various metals, minerals, the actual cation and ion reactions, what voltage frequency, what is the charge of the cells to that degree of finesse and micro, we have to go detail. So
Okay, okay.
this understanding gives us a very I should say, again, it's an interwiring of the brain. When you are studying anatomy, that's the structure, physiology, that is the functioning, and biochemistry is the hormones, the which are linking the two, how the anatomy and physiology are actually functioning. There's the endocrine molecules, the neurons as in the thinking integral unit of the brain, nephrons is the integral unit of the kidney, how this is functioning through chemical responses. So biochemistry has a lot of chemistry involved in it. And friends, if you have your organic chemistry in place, you will find biochemistry very, very zip zap zoom. So this is why at every level, your concepts are not just for marks. That is one part of the story, but they are for your larger understanding and building blocks to a good medical understanding. Next, we
Mhm.
come to microbiology. Now we have come to the second prof, the subject of microbiology,
So the first prof comprises of Dr. Saab what all subjects?
anatomy, physiology, and biochemistry.
For one long year, you study only these three subjects.
Yes,
So this means this shows the importance which is accorded to these foundational subjects, and that's where Dr. Surbhi's approach, like how to make the best of the MBBS program, because generally we feel we are in a euphoria, we are in a state of euphoria, we have just earned our well-deserved success, and but then that success is just the end of a grand beginning, and the whole first year we
absolutely.
try to dissipate it across in jubilations, in a lot of recognitions, but this is the foundational step. If the framers of the medical education across the globe, for that matter, have created a whole 1 year academic year, and friends, I tell you that the rigors of academic in the medical college is far, far, far higher, because human body is considered to be the best machine so far. We engineers, we technocrats are really trying our level best to create human created machines of various denominations, but then nothing has even surpassed even a fraction of what Mother Nature has really given to all of us. This best machine called human body. And these engineers of human body, the doctors, they're not engineering it, they are doctoring it for that matter. So I think the importance, the emphasis, just three subjects for the whole academic year. Just try to understand there is no semester system out here. There might be tests, but the whole prof, the first prof, I think it's the most arduous of it all, because three foundational subjects, you have to really get into the nuts and bolts of it. Thank you, Dr. Surbi, for this deep insight. And moving forward to second prof, please illumine us.
So the second prof starts with your microbiology. Microbiology is something which is of course, all the four subjects go hand in hand together, but I'm starting with the first subject of the second prof, which is microbiology. In microbiology, we are talking the bacteria, the fungi, the viruses. What you've studied, just an opening snapshot in your 11th and 12th. You are studying the entire classes of these bacteria, entire classes of these viruses, entire classes of these fungi,
Mm.
and what kind of diseases they are causing. What are their life cycles? How these bacteria, where the world is witness to the COVID pandemic rather, which affected the entire world, and it was a global emergency. Now, it is here that, the microbiology concepts are coming
Mm.
into play. Every,
So in
disease,
fact, you go to any
infectious
doctor, I
disease.
can say so the practical implication of it, सबसे पहले जो आपके टेस्ट लिखे जाते हैं, so I think they both comprises of biochemistry and microbiology, and this somewhere expands into become MD pathology or something like that. So I think these are the first levels of
Yes.
diagnostics. The application part of it starts here.
And then you come to when you're coming to pathology. Pathology is, of course, where we are studying this, this live organs,
Hmm.
and the pathological basis of disease. You know, that is what when you study internal medicine, surgery, and the various disciplines, the pathology is the foundational aspect of it all. Pathology is all what is abnormal. Path
Okay.
plus path plus logy. Path is diseased. So the
Hmm.
science of disease, the causative factors, the etiopathogenesis. We say etiopathogenesis takes into account etio as the cause, path as the structural. What is there's inflammation, there is infection, there is pathology talks about in a sense all that. The basis of disease is pathology. So in that we will be seeing a lot of organ specimens, understanding their nature. You've already studied anatomy in first prof, where you've seen the normal liver. Now you'll be seeing a diseased liver, how it looks like. And then your thinking buds should go, wild, as in, now what all diseases, microbiology, then you have to think and, understand how these diseases are caused. So before you start treating diseases, you have to understand what is normal. In the first 1 year, you're studying what is a normal human body through anatomy, physiology, and biochemistry. In the second prof, you're studying all the basis of the abnormal. What is causing the abnormality or an abnormal situation, which we call as dis-ease or disease. So microbiology will tell you the infectious causative entire universe of that. Pathology is telling you the structural basis of the human body. Say, for example, if there is a cholelithiasis, so how a cholelithiasis, is that the gallbladder has a stone. So how a stone gallbladder looks like, that picture in mind when you have seen those specimens, it gives you a lot of understanding about how the disease progression will happen, what kind of treatments should follow through. So it's all integrated. So this is pathology. Of course, all the blood tests and the entire spectrum of testing and diagnostics in the blood and fluid specimens goes through an MD pathologist whose signatures are going on the lab reports. So that essence, the studies are going in the microbiology biology lab and the pathology lab. Then we
Hmm.
go to forensic medicine. Forensic medicine, friends, is a very, very important subject also in this regard, that it tells us about the medico legal aspects of the cases. So the moment you go to the emergency department, or any patient who arrives to your OPD or to your clinic, you have to be wary of the medico legal aspects of the cases as well, because patient doctor relationship is based on a lot of trust, confidence, and transparency. But at the same time, you need to know about the medico legal aspects. This also points towards the diagnosis. Say, suppose a patient comes with, a drowning case or something of that sort, wherein there is a natural calamity or a emergency. Usually, a lot of emergency cases have a direct correlation or an implication of forensics. So, forensic medicine teaches us about all this. Forensic medicine tells us about the techniques of forensic medicine. Say, for example, DNA testing, fingerprints, and a lot of involvement of the legal law and the police also. So all this understanding as a doctor, as a medical professional, you will develop in the forensic medicine. Of course, at AIIMS, because of being the hospital which used to treat a lot of VIP cases also. So a lot of practical, hands-on forensic learning happens due to that as well.
So all the detective serials, friends, what we see, or
Correct.
all the crime series you might be watching, I think that is all based on the integrity and efficacy, both
True.
integrity and efficacy of the forensic medicine. And they deal with lawyers come at a much later stage, but the crime detectives and the defense attorneys, कि मेरे client ने crime किया है कि नहीं किया. I think that's where I think that's the role of a forensic medicine comes into phenomenally at play, because that sets the order in the society. So that's where medicine has a foundational aspect. Ki what caused that injury or what caused that
True.
casualty. I think that's a domain we will be studying in the medical hour on forensic medicine from Dr. Surbi in much greater detail, and as to how at young tender minds, from just watching these crime shows and then being in the thick and thin of it all, because when you are in that subject, I think what is the kind of an experience, and especially being a woman with a tender heart, you have to
Yes.
really meet out with that harsh and hard realities of life where
True.
heinous crimes are also conducted. How the Jessica Lal murder case was really solved by the, I would say, criminal investigators, because you see only the gory part of the human
Yes.
aspect of it. Disease is one part, but then crime uh, superimposed on things on the human body is really troubling and
Absolutely.
tough
Needs
thing
a
to
very
do.
strong heart to study forensic
Yes, yes.
medicine.
Moving forward, Dr. Surbhi,
Then, of course, we come to the fourth subject, which is pharmacology.
hmm.
Pharmacology as a subject is the science of drugs, medicines, which we say commonly. And in this is very important. You see, because this is the basis of your all your treatment paradigms and how you're going to treat the patients. So pharmacology talks about drugs, their mechanism of action, their effects, their side effects, their cross interactions. In various systems you will understand the drugs. And friends, this is not just, I would just give one general point here, that pharmacology is extremely interesting, very exciting. And it becomes exciting when you interplay the various subjects with pharmacology. So this is where, when you're studying the side effects of, say, for example, OCPs, the oral contraceptive pills, so much of facts, and you'll just understand and you just relate from surgery, from internal medicine. So keep this knowledge. It might look a bit a lot of mugging, a lot of remembering, memory aspects into it, but this is the foundation layer of your internal medicine, of all your subjects rather, in the final year. Then coming to the so this
And from
com-
an industry perspective, friends, pharmacology somewhere constitutes that very core basis of the big pharma industry, what we have, the billion
oh
dollar
yes.
plus, and what we say in the entire medical industry. Because being a MBBS, you should also have a view as to how the medical industry is operating upon. We have the medical care institutions of various levels, from a single doctor GP clinic, जहाँ पर डॉक्टर सुरभि जैसे डॉक्टर बड़े ही इन अ philanthropic and altruistic fashion बैठ कर आपकी केस हिस्ट्री लेकर, दे ट्राई टू सी ऑल योर टेस्ट एंड थिंग्स लाइक दैट. दे आर consultants for that matter, and then they डाइवर्ट यू टू डिफरेंट सब स्पेशलिटीज, क्योंकि आपका यहाँ का प्रेडिलेक्शन यहाँ है, वहाँ है, टू मल्टी स्पेशलिटी कॉर्पोरेट हॉस्पिटल्स, to the government hospitals, all sorts of healthcare facilities we have. Then we have the whole insurance industry for that matter. Thankfully, the government has zeroed down the GST, the 18% GST on medical insurance. There are issues about it, but then that's a huge industry because that finances the very cost of medical treatments across the various grades of medical facilities. Pharma, pharmacology is the science and subject, but then pharma industry for that matter, दवाइयों की जितनी दुकानें हम लोग सारी देखते हैं, दे डिस्पेंस दैट, बट देन द एंटायर प्रोडक्शन ऑफ इट ऑल, एंड उसके भी पीछे जो बिलियंस and trillions of dollars which go on into producing that pharma molecules. I think that is a global industry for that matter. India has got very specialized institutions of industries like Naipmar and others. So I think that is where the big money also comes in. A lot of regulatory bodies are out there. We would be touching upon these very aspects of industry and facility interplay in yet another podcast series of ours, which is called The Future of Healthcare, where we would be touching upon, because doctors will be being a postgraduate diploma holder, a kind of an MBA program, MHA program, Master of Healthcare Administration. That is to how a healthcare facility brings together the various elements of the health industry, how to set up an hospital of various denomination, because that is something which is also very exciting to learn. Because after being a doctor, you have to choose as to what trajectory you have to, the various career clusters which are available out here. You can choose to become a GP serving a remote and a rural locale, bringing out the much needed impact. And with the kind of technology coming into play, you are not alone over there. You might be sitting on the Siachen Glacier and still beaming the healthcare records, the history of the patients to the whole networks out there. We will be touching upon in subsequent and different series for that matter. Yes, Dr. Surbi, please move on. Yeah.
So coming to this completes the 1.5 years of the second
So you
profession.
are saying there are four subjects in Prof 2.
Yes.
Okay, the microbiology, the second one you touched upon, the
Pathology, forensic medicine, and pharmacology.
so just friends from 3 to 4. If you see the ratio from 3 subjects in the first prof to 4 subjects in the second prof, and let's now see what lies in store for the next 2 years towards your journey to become a very efficacious medico, Dr. Surbi. Yeah.
So the final is the, is the really summum bonum where you get that DR dot, after your internship. So, well, this essentially comprises of 5 subjects, five, but each of these have sub-subjects or branches with them, So if I talk of these five, we have internal medicine, we have surgery, general surgery, then we have pediatrics, we have obstetrics and gynecology, and fifth is the community medicine. So these five are now all, you all that you've studied is of course coming in action, plus some more, lots of it, loads of it. Internal medicine will take you through all the disease spectrums in the various organ systems which you've studied. What all diseases exist? Now, here is the blast. All the disease spectrum, the diseases will come onto you, how it is caused, whether it is nature is infective, whether it is lifestyle disorder, how it is the etiopathogenesis you will study. Then the epidemiological statistics, as in how it is, how much is occurring in the world, in India, and the national healthcare programs. All then, of course, the programs come in community medicine largely, but then the biological, the medical, clinical aspect of that you will be studying in internal medicine. So, how it is caused, where, how much it's occurring, what is its treatment paradigm? That is the core importance. How you will approach the history taking. Here comes the clinical methods, the ward rounds. The you are exposed to the hospital now. You start seeing patients, you start seeing cases, you start understanding, oh, I saw that, the thyroid is in the neck in this region. How this is how you measure the pulse, how you feel the pulse, and what is a normal pulse, what is a thready pulse. So it's a universe in itself, clinical methods. And in internal medicine, you will study, of course, the practical history, physical examination, and then treatment paradigms, how treatment strategies, clinical protocols, all this you will be studying. Then we come to surgery. My dear friends, surgery is in itself a unique and a huge universe in itself. Surgery takes you to the OT, first of all, and you learn the art of scrubbing, how what you would have seen in medical fiction serials. Yes, you're going to wear that gown, you're going to wear that mask, how you scrub, how you wear gloves, how you wear those OT slippers, enter the OT, what are the rules of the OT. All this is very exciting, but yes, of course, it's very critical. It's very important. It's very serious. It needs a lot of sobriety and a lot of gravity to it. And then when you enter the OT, what you study in surgery is the various surgeries, how they are performed. And the aspect of surgical audit you study here. Whether what I mean by surgical audit, as in whether a surgery is needed or not in a case, that merit, that decision of risk benefit analysis, this you study how and why a surgery should be done. And when a surgery is done, then what is the post-op recovery methods, all that. So our textbook, Bailey and Love, we used to
And
study.
these subjects go concurrently for the whole two
Oh,
years,
yes.
Doctor.
All the subjects
Well,
go
this
concurrently.
means 104 weeks you study these subjects. So,
True.
what's kind of workload for a particular subject? Like in a typical week, how
Mhm.
many lecture hours and how many ward rounds? Matlab, if you are studying these 5 subjects for 2 years, so
True.
what kind of an hours are you devoting every week for every subject?
So the division is equal,
Hmm.
the weightage is equal,
Okay,
and
okay. Across
weightage
professionals.
across professionals, the weightage is equal for all the subjects, and the essential curriculum hours, like Monday to Saturday, we used to have our
You are
the
not a 5 day week kind
no
of a.
healthcare industry all run 6 weeks, six
So,
days a week.
friends, if you are really looking for something soothing, I think healthcare is not for you. The
Mm.
weekends and even on the Sundays, perhaps being a doctor, so you might
Yes,
be expected on call for that matter.
and of course, there's nothing called as a holiday in a healthcare professional's life, because
Mhm. And
all
you
the
don't have long holidays across?
well, we do have short vacations in the medical college years,
Mm.
some interspersed windows. But in the internship time, there is no holiday. Internship is something on
So
31st
typically,
January.
how many holidays, Holi, Diwali और ये जो इतना सारे festivals होते हैं, what kind of holidays you enjoy?
So in the internship, of course, there's no holiday.
No, but in your studies, say in third prof, for whole 2 years, apart from your Sundays, what
Apart
kind
from
of,
the Sunday case.
huh?
So Sunday, of course, is a break, and yes, we used to have some gazetted holidays in the medical
That's it.
colleges. Yes,
No long vacations, ki
and long
summer
vacation.
vacation, winter vacation.
There's a 2 to 3 weeks, as far as I recall, a summer vacation.
अच्छा अच्छा, that is administrative, that keeps on changing. Fair enough.
Yeah, yeah.
But इतना मौज मस्ती का time
No,
नहीं.
no, 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 not that
हाँ
kind
हाँ.
of school going vacation types, winter break, summer break, short 1 or 2 weeks, quick break. Because, of course, medical curriculum keeps you on the toes. So that training of commando training
And
has
what
to
kind of a
come.
bunking regimen you have in the medical colleges?
Well, of course, AIIMS, we have 0% compulsory attendance.
But
So,
then,
but you won't believe it. Our batches, we used to have 100% attendance. That's the beauty.
okay, okay,
That's the
okay.
beauty part of it
So the
because
reverse psychology works out there.
absolutely, because our professors are all the doyen professors. We are all craving to learn from them, to hear
वो
from them.
ज्ञान की गंगा बह रही है, आप अपनी बाल्टियां ले लेकर क्लासरूम्स में भागते हैं कि
Rather
भाई
it
कोई
used
छूट
to
ना
happen.
जाए.
Rather it used to happen that the lecture is for 1 hour or 45 minutes. The stipulated time it used to extend to 10-15 minutes more, with students asking a lot of questions.
And what kind
So,
of a day hours are dedicated to this education, the
so
grueling medical
yes,
education?
so eight
It
to
start
five, eight to
8 to
five
5.
is the
Okay.
curriculum, and lab work, in the latter half of the day. So
But
like
it's included in the 8 to 5 Naukri.
8 to 5 नौकरी तो है ही, and
Hmm.
also, and on top of that, of course, when you
Library
come back home,
studies, self
library study
studies.
sessions, self study sessions. So just hardly we used to take half an hour or 45 minutes of break just to. I mean, I personally had that schedule, and many
Hmm.
of my class fellows at AIIMS, we all used to study in the library, in the studies, self study cubicles, and reading more books, because what happens, a core textbook is one, but when you are endowed with such a good library, then naturally the brain stimulation, seeks that
So,
you
Dr.
you
since
get
it's a
it.
primary video, you have touched upon almost all the subjects for that matter. We will be covering in much greater detail later on.
True.
As you said in the very start of this session, that kids pick up that the aspiring medicos, they pick up one or the other contours of their future professional career somewhere or the other, either
Mhm.
from here, say, if the kids are coming, if the students are coming from medico families, they have got a very
Yes.
clear view. People who are first generation medicos, they are still formulating their opinions and things like that. तो
Mhm.
लगभग मोटा मोटा how the people trifurcate, like there is a term called triaging in the medical space. So when
Mhm.
we are saying in this session कि how to make the best of the MBBS program,
Mhm.
तो अगर किसी को USMLE के लिए जाना है, US for higher studies for that matter, if someone has to fight for the PG entrance examinations for that matter, and someone has to really relish and cherish the most of the MBBS program and learn it as an hands-on person. Ki I will go out in the world, treat patients, and then I will think over. Some people want that kind of, like in your personal case, you took 2 years off and then you chose the medical administration career further and forward.
Mhm.
So थोड़ा इसके बारे में बताइए कि when this trifurcation happens and उसका impact क्या होता है real education के takeaways में, मतलब, and what is your prescribed kind of trajectory?
Yes. So, well, the current trends which are that the moment the student is entering the medical college, from the first day itself, he or she has made up her mind, his or her mind, that I'm going to be so and so specialist. Usually. And this view is, as you said very rightly, they have, it's running in the families, or they have already made up their mind or something of that sort. Now, I would recommend here, I'm just hitting the bullseye straight, that, medical education is very rich in terms of its various disciplines, various concepts, there is a huge information overload.
Mhm.
The information that the mind is assimilating is really huge, for that matter. So I would really suggest that, first of all, be a good doctor. what you said, the good doctor series. The
Mhm.
first goal should be I have to be a good doctor. And the MBBS degree empowers you to be a good doctor.
Okay, it
So
is enough. It is
it is enough.
substantively
It
enough.
is, yes, it is substantially enough to make you a good doctor. So,
Mhm.
to understand what all diseases are there in the community, if you really, what we say, making the most out of the MBBS program. So, if you study your subjects well, attend your ward rounds well, integrate the two, learn, do your labs well, and read your textbooks well, ask yourself reverse questions, integrate multidisciplinary approach to learning. This would help you so much in your overall journey.
So inherently, you are suggesting that until or unless you touched upon your the core of 4.5 years, try to
Correct.
immerse
Correct.
yourself
So
into the curriculum
this
and then decide
triaging,
upon what trajectory you have to adopt.
yes,
Right from the first day itself.
this triaging should rather come at the end of the internship, rather, I would say.
Okay, after internship, you're saying.
After internship, not even in the start of internship. Because you see, internship will give you, you discover your personality traits. A cardiologist and a cardiac surgeon are different, a neurologist, a neurosurgeon are different,
Ha, ha, ha,
a
ha, ha.
gastrointestinal surgeon is different,
The
and
micro nuances of it all.
yes, and your personal proclivities, which specialty suits you most, and do you need to specialize even? And if you want to be a GP or a doctor on record like me, how you would like to, what all additional knowledge or programs you would need, then you would specialize in that direction. So, for example, I went for healthcare administration because I wanted to understand that what is the grassroots, scenario and situation of the health condition in our country and how I can
So I think
impact.
just friends, what Dr. Surbi is saying is phenomenal, and it's an utter contrast to what the engineering education provides us because in engineering or technological programs, you choose the discipline right at the very head start. Whatever ranks you get into IIT, JEE, I think that remains a kind of a matter of pride and prestige कि भैया आप अगर AIR 100 हो तभी आपको कॉम साइंस मिलेगा in one of the IITs, and then the pecking order goes down, and until or unless you love numbers more or you love playing with the machines more, you don't understand it, but that's how the engineering programs go. But somewhere the medical programs gives you almost 4.5 plus 1, 5.5 years of hands-on experience, and where you can really discover yourself that where your personal proclivities and personal aspects lie in. So rather than aping the engineering field for that matter, it doesn't deal with the tough life, things like that. Employability issues are very much on the engineering forefronts. So I think medical education is quite distinguished and differentiated. एंड डॉक्टर भी अगर आप 4.5 साल के बाद भी सोचते हो तो क्या नुकसान है उसमें लाइक people generally keep on mugging and mugging and mugging. Like what we have seen is they don't go out and practice like after their license, like you said, 4.5 years plus 1 years. So what do you recommend as a practicing GP and the trajectory you chose कि भैया जाके कहीं पे बैठ के 1,000, 2,000, 10,000 पेशेंट भी देखो आफ्टर योर इंटर्नशिप एंड alongside you pursue your further I would say career trajectories. आपका इस बारे में क्या कहना है?
Well, I see. I think this is the mantra,
Hmm.
because you see, MBBS charges you so much.
Hmm.
It empowers you so much that if you do not apply that knowledge, you know, you will not be able to discover what kind of a doctor you are. The
Hmm.
discovery of your persona, your personality as a doctor. There are various kinds of doctors. There are various जिसे कहते हैं श्रेणी है चिकित्सक की, not just in terms of specialities, not just in terms of you discover, okay, this is my forte, this is my USP, and this is your aspiration, this is what you want to do in medical career, this is how you want to heal people. And this discovery, self discovery, is very crucial for a successful, joyous medical, truly gratifying,
So
healthy.
you somewhere are trying to suggest that in some of the world's best MBA programs, they say that you come with a work ex of at least 3 years. And
Yes.
if you have a work ex of 3 years, then we will admit you. So is this the protocol at our NEET PG level, or you can just directly go on and on and on?
But the current NEET PG doesn't entail this eligibility criteria. It just
Okay.
says, and during our time, our class fellows used to start preparing, right at the start of the internship. or even at the start of the first year itself. And some of the students were very clear, I have to do USMLE. So they used to start preparing from first prof itself. And some decided during the course. So, that path is, very, I mean, just before, it's quite premature, I would say. So, in my recommendation, this decision, this triaging, which paths to choose for the next step of it, or whether to choose or not, even. Well, our country, the kind of health scenario we have, as many health cases and problems you analyze, the vast variety of healthcare ecosystem, health providers which are there in our states today, in the country today, it needs the doctor on record, the GPs, the general
Mhm.
practitioners.
So,
And
what kind of a blindfolding comes into your learning? You might be a very meticulous student. I'm just asking a hypothetical question that
Mhm.
had you gone into this rut कि मुझे super specialization के जाना है from your first year itself, like your story is a quite differentiated one कि you dropped 1 year to get into your love of life called AIIMS despite being an all India rank one in the then NEET examination. You said no, I have to go to those hallowed, I would say, presence of that very college. तो आपने अगर ये नहीं किया होता तो what you would have missed? I'm just trying to put this question onto you because आप अपनी clinical practices में, as you have shown, demonstrated that you have diagnosed some of the most rare of the diseases with the help of your heuristics, with the help of your only 5 years of intense medical education at AIIMS Delhi. तो अगर आपने ये नहीं किया होता एंड व्हाट पीपल, नॉट अबाउट अदर पीपल, what you would have done differently otherwise and not become such an efficacious GP yourself?
Well, I do definitely feel that, during the start of my medical career, education at my medical college at AIIMS, I had decided that I'm going to now study, you know, even more deeply for my concepts. What I had
Mm,
studied in my 11th, till my 11th, 12th, I never studied for a rank or marks. But this conscious decision came to me that I'm going to make the best out of the MBBS program. And I'm here in a real lifetime practitioner's place. We call the medical degree as a professional degree. Means
mm,
you're not just studying for theory, but the theory in itself is theory in action.
mm.
So it is something like it's a professional degree. That's why we say interns. Why that we say internship? Internship में आपको डॉक्टर साहब बोलने लगते हैं. All the employees at the hospital, everyone say डॉक्टर साहब आए, डॉक्टर साहब आए.
And you really handle real life cases, real
Oh yes.
life.
Oh
Mm.
yes, and in the rural posting, we are in various other in the OT even they depute us to handle certain situations on our own as well. That is of course a hierarchical system
That is
which
what in the
is
engineering it's called
protocolized.
apprenticeship कि भाई जाके आप किसी master के अंडर
Yes,
में work कीजिए
yes.
because it's a hands-on work.
Yes, and both are professional degrees. That's why
Mm,
we say if, when you are building a bridge, I mean, I'm just saying from engineering parlance. So it's a theory in action.
mm.
So that is why it is important that the practical aspects of it, the nuanced theory concepts, the fundamental practical experiences you take, you acquire. So had I missed on all this and studied for marks only, you see the USMLE system, the NEET PG papers, well, it is an appeal to the national testing agencies and the examination boards as well that the examination curriculum stress, you know, it it definitely takes a toll on the learning, actual learning of the medical student in the hospital. And often I used to see in my classroom my fellow classmates, doing questions of the USMLE multiple choice questions in the classroom. Well, we do feel that somewhere it
So you
helps.
miss on the learning, the nuanced learning given by your professors also, because
Yes.
your focus is somewhere different. For example, you talked about community medicine in Prof 3.
Mhm.
Now, if you have to really go and become a super specialist, you give not that kind of an emphasis on that subject matter.
Absolutely. And your sensitivity to the national health conditions, the national
Mm.
health programs, the national, what are the statistics, There is a population census board. It used to be, right in front of AIIMS Delhi.
Yeah.
Every day it used to tell the figure that now a child has been born. That sensitivity to the national indices, healthcare indices, how the infant mortality rate is
So if
progressing.
you have chosen right at the early stage, you try to turn away some of the subjects, but you said that each of these subjects are intertwined.
Yes, there is a reason that this curriculum has been designed, how
Because,
it
for
has been
example,
designed.
the very famous detective Sherlock Holmes,
Mhm.
written by Arthur Conan Doyle, he was a doctor himself, and the entire pedagogy of detection, deducement, he applied his entire medical knowledge to the profession of crime detection. And
Indeed,
so,
indeed.
hmm,
And I'm not saying that do not specialize. I'm not
hmm.
giving a no to specialization, but definitely utilize, make the best out of your MBBS program and see it's
And we have seen
not
people
upwardly.
studying for cramming for 3 years, 4 years, 5 years, and endlessly, like the
True,
wasteful UPSC examinations, wasting those very prime years where
true.
they can be productive for the nation for that matter.
And let
And
me let me tell you, the GPs are very powerful. If
mm,
our country is backed by a spine and backbone of GPs like the NHS, which is there in the United Kingdom currently, the healthcare industry pyramid, the way it is, based out today, it would be just inverted. We would be
mm,
having very few emergency cases, complicated cases in the tertiary care hospitals. Today, AIIMS emergency is catering to, there is such a huge pressure overload. I mean, this, of
which
course,
can be detected right at the primary level itself.
absolutely. Prevention, monitoring, and conservative management, diagnosis, differential diagnosis, all this is the power of the MBBS.
Mhm.
Diagnosis is the essential discipline. I am really very emphatic on diagnosis usually. When you say well diagnosed is half the cure done. And then the treatment protocol. So,
So, Dr.
prevention
Sufi, just one
protocol.
more curiosity which comes over here is
Mhm.
how efficacious GPs you find the subspecialist? Do they have a blinding sight at that point in time? Because India does not have an institution of something called doctor on record, something we'll be discussing in yet another episode. So, if you straight away go to a super specialist, what kind of a GP he or she is, and what kind of a blinding you have encountered in your own मेडिकल जर्नी सो फार कि भाई जो ब्लाइंड साइड हो जाता है इतने बड़े डॉक्टर होने के बाद भी एक बहुत ही छोटा सा जो एस्पेक्ट है वो मिस कर गए एंड वी हैव अ लॉस ऑफ लाइफ और द मिस डायग्नोसिस और व्हाटएवर
You see,
कॉम्प्लिकेशंस.
the metro cities today, like Delhi, Bangalore, Mumbai, Kolkata, are backed by a lot of multi-speciality hospitals, in which the specialists are sitting right in the next chamber. Different departmental specialists, different specialty specialists are sitting right across. So the current trend, which has become, is that even for a smallest problem, you go to straight to a specialist. They're easily accessible, and the entry to a specialist is without even seeing your GP. So, and the patient identifies on his or her own, this is a skin problem, through Google doctor method
That's
or
not a
anything
problem,
for
but
that
does a
matter.
super specialist
I'm coming to that.
goes through the
I'm
GP
coming
route
to that.
first? Yeah, yeah, yeah.
So that specialist, if it's a orthopedician, he will not. I mean, there is this point of tunnel vision or blindfoldedness. And I have
Hmm.
noted it has become a matter of convenience rather.
Hmm. Hmm.
And
Hmm.
it is very important. Very few specialists in one field would take even, the liberty or the pain, or I don't know what is the reason, to comment upon the other systems. For some reason or the other, the specialist is really a top-notch authority in his or her own specialty. But when it comes to the other systems, they avoid to comment. Why?
But can't they use the power of technology to consult the other specialists in that domain, or they don't do it? The training is not even there to see the body as an integrated whole.
Well, I think the Indian medical system, the way it is based right now, there is nothing called as a D2D helpline today, or in
Okay.
terms of technology, that culture is not there.
Mm-hmm.
So, of course, some hospitals are having, in oncology, we have tumor boards. Now,
Mm-hmm.
why only in oncology? This board meeting, should be in all the departments. and interdepartmental discussions. Well, some corporate hospitals in the top-notch metropolitan cities are coming to this approach, but as a general speaking, this is not there.
So,
And
how do you, as a GP, get so much empowered? Just tell us your secret sauce of the Amazonian Grand Rounds, your
yes,
professors, your entire Arogita community around the AIIMS New Delhi batches from
so
1956 onwards. Yeah.
yes, truly blessed that you very well said it, that the AIMS Grand Round is something which is, it is like the guiding light to us, GPs. And, whenever every day, some 80 to 100 cases, top-notch cases are discussed on the Grand Round, in which specialists from
In a
across
pure philanthropic zeal, in
in
the
a
pure
pure
academic
philanthropic
commitment.
zeal,
Yeah.
in a pure zeal to help humanity, to help the community, and all the specialists they are from India, Dubai, Australia, USA, wherever they may be at any hour. In fact, one a.m. in the night, there are five specialists arguing with each other, even at the wee
So
hours of the
don't you
night.
think that this very informal initiative of the AIIMS Onions, as we love to call it, because there was a question, why are you calling us as the AIIMS Onions? Because we said that there are layers and layers, the infinite layers of medical diagnostics and the prognosis of it all, and then you have to come to that accurate trajectory of medical treatment. So, in your opinion, because we are just converging how to make the best of, you are endowed, you are uniquely privileged to be an AIIMSonian, getting on to your AIIMS network. You have that personal commitment. But then, if we have to see a Vikasit Bharat, a Divya Bhavya Samradh Bharat, it has to be an Arogya Bharat in the first place. From the bodily Arogyata, from the mental Arogyata, and also the bliss and the happiness which is out there from Annamay Kosh to the Adhyatmik Anandamay Kosh. So, how do you see this experiment, I think, this institutionalization of the AIIMS experiment as a national policy? Because this will give somewhere our young I would say young medical doctors, now they have come into the hallowed presence of medical colleges, they will study well, but until or unless they are facilitated, they will feel, oh, if I will become a GP, if I will use my MBBS knowledge to heal, I want to use it across the societal pressures are not that very right. The medical industry, the pyramid of incentives is completely inverted. It doesn't value the societal parlance for that matter, even, and people are suffering due to this overemphasis on subspecializations, because nobody has that bird's eye view and there is no doctor on record to guide you. Like in the courts, you need to have an advocate on record who looks through all your file, that everything is properly in order, all the evidences are finely placed, and then you summon all these big giants to argue your cases from constitutional perspectives, from global case studies, so and so forth. But somewhere or the other, India needs this institution of doctor on record. That is one. But from the medical CME, constant learning paradigm, and to empower the institution of GP, what are some of the three core steps you would really like to make? Because that will only give our MBBS doctors the grit, the emphasis to really hold on, stay in the society, and then move on for if they really want to do any subspecialization or not. Yeah.
See, one I would like to say is that the D2D referral helplines, the
Okay.
D2D discussion channel should be encouraged by the government also, by the various healthcare systems also, by the doctors themselves. They must, take a step forward and
So
create
the
such
government can endow that the super specialists who are enrolled in that
a.
helpline, they can be paid handsomely to compensate for their time and things like that. So the GPs
Absolutely.
can directly consult that quickly, because that's a D2D consult, not a patient to doctor consult, and that will
Yes.
empower their learning and also help the speedy diagnosis.
Yes, because when if you see the healthcare system delivery from top to bottom, when we go to the states and to the districts and to the villages, there that's where the specialists are just not there. The
Mhm.
concentration of the specialists is around this top-notch tier two,
And they're not needed to also, because the
and they're not
concentration,
needed
that is why the
also.
tertiary, the three-tier medical system was devised by our framers,
Yes,
from
yes.
PHCs to CHCs to
So,
3HCs.
so, so this the functioning of the GPs at these levels, from the primary healthcare center to the secondary healthcare facility. This can be really augmented, made more efficacious, and made much more powerful by the D2D discussion helplines of the doctors themselves. We have patient to doctor tele helplines. eSanjeevani, the government has launched. But what we need is more now the D2D discussion helplines. That is one. And this would
Mhm.
really revolutionize the entire healthcare. I feel the delivery in terms from the GP's aspects point of view, and empowering them is really critical for the good Arogya Bharat, which we are talking. Next, I would say is that use of technology, aiding
Mhm.
and helping the GPs to use technology in various fashions. Like for example, if you're having mobile healthcare units in the villages in the districts, they should be further endowed with ultrasound, X-rays. They are in some parts, but this is not there much. You know, and
The technology, in fact, if you go for an MRI, by
hmm,
default, the protocol should be that they should give you, they should upload your MRI
on
files into a
VV
cloud
transfer, yes,
so that it can be, because for the digital sake of it, there is a kind of a
yes,
vested interest at many of the diagnostic centers that
absolutely.
not to give the digital copies of it all. That's a right of every patient.
So
And
panel
it
of
can, yeah,
experts should give their
yes.
discussion and the voice on the report, and the
The real
patient.
images have to be given, because if one radiologist has given one interpretation, it should be open for multiple interpretations so that in real
Absolutely.
time, so that is where you are talking about the
And that
technology.
is where the patient should have the right to have the second opinion, the third opinion, that accuracy
Sitting
matters.
right in the comforts of his place, not
Yes,
traveling, not waiting. That's where the digital doctors, the our Ayushman Bharat digital mission has come into play, like
absolutely.
where the MBBS doctors can really help patients, taking their elaborate history, recording them out into some EMR, EHR, whatever we call them, and then take the expert counsel of the super specialist, and even that multiple super specialists. Someone might be having an aggressive approach, someone might be having a conservative one, so and so forth.
And I would also suggest here that there has to be an interplay between various healthcare layers. The
Okay.
doctors, as I see in the states, in various states in India, like say for example in Uttarakhand, a lot of pharmacies are delivering primary healthcare. The
Mm-hmm.
pharmacists are delivering healthcare to the patients. Now, what is their training level? So we have to integrate the various healthcare providers
Ah, ha, ha, ha,
and
ha.
training at
Lovely,
every level. The government
lovely.
has to come to some system of having CME credits. When
Mm.
the state medical councils are registering the doctors, they're providing a license. Why don't we have a system of CME credits? And if you attend these CMEs, and they can be all online today. Zoom and the digital mission has accentuated, exponentiated to such a level. And attending CMEs
So it
is
should not be a merely clerical compliance. You are saying
yeah,
that all our regulation has to really come to hearty clinical compliance. What your learning aspects are, and be humble about it. केवल एक डीआर लग गया, नाक हमारी कुतुब मीनार से भी ऊंची हो गई. With that egoistic aspect
yes.
has to be removed. The whole purpose has to help that last
You see,
patient in the queue. The spirit of
yes,
Antyodaya, the spirit of Pandit Deendayal Upadhyay ji, ki let the every benefit of the collective power of the nation really reach to the last mile over there. And as you said, the integration part of it all, the systemic integration. There is a lot of apartheid in states like Uttarakhand where private practitioners' prescriptions are just thrown out of the window by the public health
yes, I was
practitioner,
coming to
public
that.
health
I've just
system,
heard.
and they say, oh, we will work it up all over again. And just to show off their superiority, so there is a
Absolutely.
kind of a tug of war, and the patient loses that steam because they come from various
True.
strata.
True. So public-private partnership is a third aspect which I would like to really, urge the authorities to integrate into the system.
And
And
how to increase the primacy of the PHCs, because if we see, we are recording this medical hour from the very remote and rural locales of Uttarakhand in the Kumaon division, and whatever area we have traversed, all the districts out there, the government has made phenomenal investment. Each
yes,
of the PHCs in particular are amply endowed. But what we have seen is that the treatments are extended by the reigning pharmacist out there. The doctors are generally non-present, And
Yes.
the prominent excuse is, bhaiya, they are mugging up for their PG exam. And that's where I want to bring in Dr. Surbi, कि भैया वो मगने और पेशेंट देखने के बीच का जो बैलेंस है, and
That's
some,
where the entire story comes, you know.
yes. Hmm.
The entire philosophical approach to medical education has to undergo a drastic change,
Hmm.
wherein entering a medical degree or a medical college does not mean you are getting a license for ₹1 million. The entering a medical college means you are given the license to touch the human body, to heal the human body. It's a huge responsibility. वो कहते हैं ना, पता नहीं किस रूप में नारायण मिल जाएगा. When you start seeing the patient as a divine embodiment, as a human life, not as a client. So
So the
that
pyramid of
approach
incentive has to be reversed some
has
way.
to be
कि
reversed.
if a
But
GP
doctors
ने
have to
क्रोसिन की
be,
गोली से
yes,
पेशेंट को ठीक कर दिया, तो उसको इंसेंटिव मिलना चाहिए कि आपने कम से कम खर्चे में, in the most frugal of the sense, if you
absolutely,
have treated,
absolutely.
the
In our
government should
in,
really, and
in a,
technology is available these days, कि भाई अगर आपने ठीक कर दिया कम से कम टेस्ट में, accurate diagnosis, optimal investigation and judicious
yes,
medication, the
medication.
triumphant ride of the AIIMS paradigm, I think that GP should be rather, the ethics and regulatory board of NMC should really create a kind of an
Yes,
incentivization
there has
schema.
to be an incentive structure. And also, I would like to add here that, the medications which are at AIMS in our community medicine training, we are taught, that first how to give the prescription, how to write the prescription, that is one thing. But when you have written the prescription, what load it will put on the pocket of the patient? You have to
Hmm.
start from there. How the care compliance will happen? Who is the caregiver in the patient's case? So when you see the full cycle, only then the result would come, na? Then your patient would heal completely and
So
efficacy
I
of
think it has
treatment
been a
would be there.
lovely session out here, Dr. Surbi. I would take your leave at this juncture because this is going to be an ongoing series. And जो कि भारतीय सनातनी प्रज्ञा में कहा गया, ओम पूर्णमदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते. So somewhere or the other, this MBBS program, which has been devised by our doyen medicos for that matter, यह पूर्ण है अपने आप में to a great extent. और जैसा कि डॉक्टर सुरभि बताती हैं, शी विल ट्राई टू प्रूव इट अपार्ट फ्रॉम और रिसर्च, कि 60 से 70% जो केस लोड का जो एंगल है, एंड इवन देन मल्टीप्लेक्सिंग दैम, डायरेक्टिंग दैम एज अ पोस्टमैन टू द अदर सब स्पेशलिटीज, सुपर स्पेशलिटीज, 70% तक एक एमबीबीएस के पास वो ताकत है कि वो शरीर के जो सारे रोग हैं, सारे जो डिसईजेज हैं और डिसकम्फर्ट्स हैं, उनको ट्रीट कर सकता है. द फर्स्ट लाइन जो जूनियर एडवोकेट करता है, कि वो सारे एविडेंसेस को रिकॉर्ड करता है, वो आपकी एनवायरमेंटल हिस्ट्री लेता है, वो आपके सारे कागजों को एक जगह लाता है, और आपका एक फ्रेंड, फिलोसोफर और गाइड बना रहता है जीवन भर. आप कार्डियक को दिखाइए, आप नेफ्रो को दिखाइए, जीवन में 50 प्रकार के क्वेश्चंस आएंगे, पर कहीं ना कहीं वो जो एमबीबीएस डॉक्टर है, जिसको ही इज जस्ट एन एमबीबीएस, ये जो सोसाइटल कॉन्टेम्प्ट है, इंडियाज colonial kind of a mindset which we still persist in the 75th plus year of our independence, it has to go somewhere and back to basics, what Swami Dayanand Saraswati said, back to Vedas. So somewhere or the other, the public health crisis which we are witnessing, कि लाखों करोड़ों खर्च करने के बाद भी मिसडायग्नोसिस हो रहे हैं, बिकॉज एट द फर्स्ट स्टेप, जैसे ट्रायल कोर्ट के लेवल पे ही अगर आपने एविडेंस गैदरिंग ही नहीं की, पुलिस जो इन्वेस्टिगेटिंग ऑफिसर है, ही इज द मोस्ट पावरफुल लॉट ऑफ इट ऑल. आप कितना भी लोड लगा लीजिए ऊपर हाई कोर्ट्स में और सुप्रीम कोर्ट्स में, बट जो ट्रायल कोर्ट ने बात रख दी, आई थिंक दैट रिमेन्स, दैट्स अ डिफरेंट मैटर. बट वी आर सेइंग that kind of a power and privilege has to be provided, and this becomes especially so very important because now a deluge of doctors would be coming out from our enhanced number of medical colleges, and until or unless these guys are put up into a structure of serving the societies, how many are 66 megapolises going to absorb these doctors per se, and the kind of a market of lemons would become uh, over there. So we have to have a public health policy out there. That's a matter of our future of medicine discourse. But right in this medical hour where we are talking, making the most of MBBS program, the purpose is, friends, the MBBS degree is a whole in itself. Try to treat it that way. It gives you the agency, the license, the authority to make an impact. And friends, people are not kratagna, they are not ungrateful, they will pay you well. Because if you can save Dr. Surbi, by her 300 to 500 kind of a fee structure, and at most testing 3000 5000 at max, she delivers efficacious healthcare to almost 95% plus of her patients, and her efficacy index is to that level. And wherever she feels the requirement of further hospital tertiary level interventions, now we have got such an elaborate network of AIIMS in almost every state. She sends this to the patients well in time. Somewhere or the other, the inducements which are out there in many of the subgraded medical facilities, they keep on waiting and waiting. They don't have the humanity to consult, because medical profession is, I think, a kind of a combined approach where you keep on discussing, finding out, and the empathy part of it all, which gives you the commitment of it all. So, friends, this is how you make the most of the MBBS program. All the first prof, second prof, third prof, the beautiful pyramid of 3, 4, and 5 subjects in those 1, 1.5, and 2 years. I think this is a quite a enigma in itself. It is quite a 5 plus 4, 9 plus 3, 12. The Dwadash Bhagavatacharyas, we can say so. The 12 subjects, the 12itude of it all. I think that makes you a phenomenal doctor. And once you have gone into it, once you have in the American society, we see people after having worked in different professions, then they choose it over there. So it is not just a licensing exam कि एक बार पार किया पूरी जिंदगी बन गई. I think that comes from that colonial mindset कि एक इम्तहान 3 घंटे का पार करके हमारा तो जीवन भर का सुख हो गया. Being a doctor is a lifelong commitment. It's a lifelong profession. Yes, it is tougher, but the kind of respect, the kind of love and affection you get from the society at large is phenomenal. And the country, India, is still endowed by doyen doctors like them, whom you really treat like gods. And the Americans, they lament, oh, you guys have such a phenomenal medical ecosystem. And thanks to our founding fathers of this modern republic, who did not let this medical profession commercialize to that extent, not dependent on it all, we would be unraveling the further threads uh, in our subsequent episodes. Thank you, Dr. Surbi, for such a phenomenal overview. I think this is something which we all lack. हम लोग एक टनल विजन, एक मायोपिक व्यू के साथ चलते चले जाते हैं. बट यू जस्ट गिव अ बर्ड्स आई व्यू कि 3 सब्जेक्ट से मेरी लेयर 1 फाउंडेशन बनती है. उसके ऊपर हम 4 सब्जेक्ट्स को रखते हैं, एंड देन 5 अप्लाइड एस्पेक्ट्स ऑफ इट ऑल, एंड देन यू गो आउट इन द वर्ल्ड फॉर 1 rigorous year of internship, not just doing the proxy work and things like that. And then you license, practice in the real world, and then take your trajectory to become a superior a neurosurgeon, a cardiothoracic surgeon. Who stops you from that? And somewhere or the other, these practices, even in the public health system, a protocolization of it all, you have to come through a doctor on record. You have to have that rigorous process. I think कुछ भी छूटेगा नहीं. So with this, we close this medical hour. We would be back with each of these thematics. What Dr. Surbi learned in the anatomical classes, कुछ किस्से मेडिकल कॉलेजेस के, कुछ प्रोफेसर्स, उनकी बातें, उनके ज्ञान को कैसे पकड़ा. और यह केवल सुरभि वैश का एक सेल्फ, आई वुड से, यूलोजाइजेशन नहीं है. Somewhere or the other, she is driven from that spirit of sharing the knowledge, the learnings, the experiences with the larger aspiring medical community, so that we can really touch upon that vision of Arogyata, which is encapsulated in Jivem Shardha Shatam, Pashyem Shardha Shatam, Buddhyem Shardha Shatam, Rohem Shardha Shatam, Pushem Shardha Shatam, Bhavem Shardha Shatam, Bhuyem Shardha Shatam, Bhuyasi